When should kids start learning about skincare and how do we make healthy skin habits stick? I'm Dr. Mary Mina, and I'm going to be answering all of these questions and more on this week's episode of The Skin Reel. On this week's episode of The Skin Reel, I'm joined by Dr. Betty Nguyen, who's a dermatology resident at the University of Miami. When she is not studying and seeing patients, she has created this adorable series called Medical School for Kids, a book series all about the different organ systems in our bodies. Of course, I love the one about the skin. I think this book series is so critical for children because we often think of skincare as something reserved for grown-ups or tweens and teens buying overpriced things that they see on TikTok. But the real skincare and skin health revolution actually starts way, way younger. And I love how Dr. Nguyen is sharing with us why she created this series with her fiance and how teaching kids about their skin and their bodies can lead to lifelong healthy habits and confidence and empowerment. I love this episode. If you have children or you are around children, you know how naturally curious they are. They ask so many great questions. And I love how Dr. Nguyen and her fiance, Dr. Pham, are helping kids become skin savvy one bedtime story at a time. If you have kids or you know kids, you're definitely going to want to stick around for this episode. Dr. Nguyen, I am so excited to have you on. Since I first heard you and your fiance discussing the book and the series you guys have created, I knew I had to have you on because I just think they're amazing and I wanted my audience to hear all about it. So thank you so much for being here.
Thank you so much for having us, Dr. Mina. It's such an honor.
As we were talking briefly before we started recording, you are a first year dermatology resident. And I remember my first year as a dermatology resident, and I had no time. At least I felt like I had no time. So, how did you create the time to create this whole book series as I imagine even an intern, right? And now a resident?
Yeah, so we actually started when I was a medical student, and Brandon, my fiance and co-author, was a first-year resident at the time. And we came up with this idea that we wanted to teach our nephews and nieces more about what we do at work. And we realized there weren't any books out there that quite teach about different medical specialties. So we had this crazy idea, what if we write a book, dermatology for kids, ophthalmology for kids? And our first draft was actually called For Babies, since at the time his nephew was a little 1-year-old toddler. And we wrote the draft quickly and realized that we had no idea how we were going to publish this, what we were going to do. And that's a whole separate story. But the inspiration came from wanting to teach the young ones more about what we do at work.
Yeah, I think there's such an interest in skin health, it seems like nowadays in children, but really more like the tweens and teens. But I love that this is teaching even younger children about their skin and their bodies and how to take care of it because kids are curious and they want to know. And my kids are now 10 and 11 and I was we were reading the book together learning about it and so I just think it's brilliant, and I love that you've created this. Have you guys gone into other organ systems, or are you just sticking with the eyes and skin?
Yeah, so from there, we got so many requests to cover other specialties, and our readers wanted to cover cardiology, neurology. So those were our following books. And now we actually have 34 books and counting. And we're hoping to someday hit 100 books, cover all the different medical specialties and even subspecialties and careers in healthcare that aren't physicians. So we have like a dentistry book, a nurse's book, and we're expanding in that field as well. We just hope to teach kids all that there's out there not only about their bodies, but about future career options.
Yeah, I think it's wonderful. I mean, I feel like sometimes I need a book on radiation oncology because for the longest time I thought, what do these guys even do, right? Down in the basement giving radiation. So let me know when you come out with that one.
Oh, stay tuned. That is a great topic and a great idea.
So let's go back to skin. So, is there an age group that your book is really geared towards?
Yeah, so we have kids as young as 1 years old who reach for the book. They don't know what they're looking at, and they're mostly looking at the pictures. Our books are geared for kids around ages 3 to 10. I think the kids on the 11 and older side can definitely learn from it. And we have adults who are reading to their kids who are learning from these books. So we joke that these books are, 3 to like 103. As long as you can open your eyes and read, it's for you. But I think a lot of kids around 3 to 8 years old really appreciate the books and are able to grasp some of the concepts and ideas that we present.
So I love the pictures too because they show kids of all different skin tones and they show great pictures of what the skin lesions look like in a very like kid friendly way, right? This is by no means a textbook primer. It's really like a fun picture book with good information.
Yes, that was our goal to definitely break down these large medical concepts into easy to grasp bite sized chunks. So, every one of our books has a flow. We start with the anatomy, we talk about the structure. So, for instance, the structure and functions of the skin. So, the structure, what the organ system does, things that can go wrong with it, how do we diagnose that, and how do we treat it? And I think a lot of kids are able to grasp full medical terminology. So, we do break down the concepts in a simple way, but we don't change the word uterus and call it like an abdomen. We really use the full medical terminologies, and we believe that kids are able to understand it and appreciate it because they're able to understand these concepts that I think many adults don't even understand if we present it in a simple way.
Exactly. Yeah, I think that's wonderful. And our skin, we can see, kids can see their skin. They see a mole or a freckle or a boo boo, right? Which I know you would never use that word in the book, or an abrasion, right? Or ecchymosis or a bruise. So I think it's great because kids are curious. I know when my children got warts, they were very intrigued with what is this bump on my knee and what is this rash I have, right? So they're just innately curious. So I love that, and as skin is perfect because they can see their skin, so I think that's super easy for them to grasp. What are some of the key things you talk about in the Dermatology for Kids book?
Yes, we talk a lot about the structure and function of the skin. So we talk about the three layers of the skin, including the epidermis, the dermis, and the hypodermis or subcutaneous. We talk about what lies in each layer and the function of the skin overall to protect the body, to keep it warm, to keep it away from or keep the germs out, right? And keep your organs in. And then we discuss different ways to protect it and things that can go wrong. So we talk about the ABCDEs of melanoma. It's so funny that we discussed these ABCDEs, not thinking more of it. When I first wrote this book, I was like, oh, what would be cute? ABCDEs, kids are learning the alphabet. Maybe that would be fun to throw in there. And then we had a young reader who was reading with her dad, and she pointed out a suspicious lesion on his body, and he was motivated to get it, evaluated by a dermatologist after reading this book. So it turned out they got a biopsy. It was a basal cell carcinoma. We didn't think much of it when we started writing this series, but we realized that there was such a need for key medical information about children's bodies and adults' bodies, things that are affecting the kids in their everyday life, affecting their friends or affecting their parents, and different medical conditions and terminologies that might be coming up at home that kids might not have a firm grasp about. And so our books really try to address that need and equip kids with not only the terminologies, but also the understanding and the fundamental understanding of how their body works and what can go wrong.
I think I laugh, I joke that sometimes people think our skin is just our face and it's just for aesthetics, right? And they forget that skin is a whole organ system. It covers our entire bodies, including our hair and nails, and that it has functions beyond just aesthetics, which not minimizing that. And of course, that's very important for psyche and all that. But skin really does play a critical role in so many things that we tend to forget about. So it's important to even teach these young ones about that.
I completely agree. And I love what you're doing on this podcast for not only parents, but also for families.
What are some healthy skin habits that children, early young kids, 1 to 10 or so, before the tween age hits, right? What are some healthy skin habits that you would like families to gain from reading these books?
I think an essential habit is washing your face every day. Once in the morning, once at night. It doesn't have to be with any special cleansers, just soap or no, just water, just washing their hands with soap and then using their clean hands to wash their face with water, patting dry with a towel is so crucial because it teaches kids the fundamentals of how to keep their skin clean. It teaches kids a routine, right? In the morning, we wash our face. At night, we wash our face. And that kind of helps us wake up in the morning and kind of helps us wind down at night. I think these routines are crucial to lifelong success and to lifelong health.
Yeah, and for any parents out there, there comes an age where you stop bathing them, and if you haven't explicitly told them, what to wash, they don't always know, right? So, it's good to just check in with your kids like, "Hey, did you wash your face today? Did you, wash your feet, your hands, and all that?" Because I think we just assume, "Oh, yeah, they know. They know how to wash their bodies, to wash their skin," but do they really? They don't always. So actually talking about it is helpful. I found at least from personal experience.
Oh, I completely agree. I've had so many patients with acne who have told me they don't wash their face in the morning. I think that's such a crucial step to just keeping a healthy skin and skin barrier.
Right. And of course we hear tweens and teens talking about skincare all the time, but it's usually about using lots of products and trying different things, a lot of times expensive, following trends. What do you advise parents and kids in this age group or even a little bit younger? What do they need for skincare? Do they even need any skincare other than washing their face?
That's a great question. And I know that recently with TikTok blowing up and all these advanced skincare regimens circulating online, I think it's important to tell kids that you don't need to do much. For most patients, you don't even need even like a 4-step routine. It can be as simple as just washing your face once in the morning, washing at night, and then in the morning after washing your face, applying sunscreen. And for kids, I recommend using a zinc, so mineral based zinc oxide or titanium dioxide, which sits on the skin and helps block the rays without getting absorbed systemically. And then a moisturizer for people who tend to run on the drier side. But I think that's all you really need just to clean the skin, protect it with some sunscreen, and moisturize to keep it nice and healthy. And of course, if the kids have some other underlying conditions going on, like eczema or acne, that's when you might want to think more about the active ingredients like retinols or benzoyl peroxide. But for the majority of kids, they can keep it simple. They just need to wash, put sunscreen, and moisturize. And the moisturizers can also be very simple with like just glycerin, ceramides, nothing fancy.
Right. I mean, that's basically my skincare, except for a retinoid. So again, really, it's can be pretty simple, and especially for kids, it really should be simple because especially the little ones, right? Like they don't want a complicated routine. It's enough to have them brush their teeth and wash their face. But I love that you mentioned putting on sunscreen because this is something that I think is so crucial to start early and to help it just become like muscle memory for kids that I wake up in the morning, I brush my teeth, I wash my face, and I put sunscreen on, right? That it's just habit, it's just routine. Then you don't have to think about, oh, it was rainy this morning, now it's sunny, and I didn't have my sunscreen. So just like getting into this habit early is so, so key.
I completely agree. I think it's just like flossing at night. Once it becomes a habit, it's so good because many people don't know that sun damage is cumulative. A lot of people come to us in their 60s and they're developing all these skin cancers. It's from the cumulative years of sun damage where they weren't wearing sunscreen, where they were going out in the sun and putting on tanning oil. So I think instilling these habits early on help prepare kids for a lifelong of success and good health.
Right. And we know that the number of sunburns, severe sunburns you have before the age of 18 leads to an increased risk of melanoma. So this is the time to really start those habits and maybe if you're listening, maybe you need help doing those daily habits too. So it could be something that you both do together. And I find as a parent, they tend to watch what we do or our actions more than what we say. So modeling the behavior. My kids always see me put my sunscreen on every day. They see me reapply it. They see me put a hat on before I walk outside. So these are habits that they see me do. And so then they just emulate it, even though they're older now and they could say, no, I don't want to wear my hat, but it's just muscle memory. They just think of it as this is what we do when we go outside.
I love it. And your kids are going to have such beautiful skin as they get older.
I think that's probably due to my husband, but I also think focusing on health rather than aesthetics, beauty, whether you're pretty or not pretty. I think putting the focus on health, keeping your skin healthy, keeping your body healthy is such a powerful message. And children they're not too young to hear that, right? Like it's so critical to hear that the sooner the better.
I agree. And I think having open conversations about health is one of the cornerstones to preparing them for a healthy life because you want to show them that you're able to have these conversations openly about how they're feeling, how their bodies are feeling. And not only that, but provide them with the education that they need to vocalize how they're feeling. And I think that's what we try to do in our books. We try to really break down these concepts into bite-sized graphs that they can little chunks that they can take with them for the rest of their life. For instance, the heart, right? You have four chambers of the heart. The heart pumps blood throughout the body through the arteries. The arteries can get clogged if there's cholesterol buildup. How can you keep the cholesterol levels down? By eating healthy and by exercising. Just really key little tidbits, and especially for the skin, right? Wearing sunscreen, keeping your skin protected with a hat. I think if we discuss these early on and often, kids will remember it and they'll incorporate it into their lives in the future once they're adults and once they've left the house and are no longer under our control.
For sure. They'll remember these books. I mean, I remember books I read with my mom and dad back when I was little, to this day, and I do, I mean, maybe I was a nerd, but I do remember a book about the body, and my brother had this invisible human. It was like a clear model of the human body, but you could see through the skin and look at the organs, and I don't know, I just thought it was really cool to understand like, "Oh my gosh, wait, that's what our body looks like on the inside. Our heart doesn't look like the heart you see on Valentine's Day cards. It actually looks like this." So I just remember thinking how cool. So maybe not everyone's like that, but I do think kids just have this curiosity, and it's important that we encourage that, and that they're I think sometimes we think, "Oh, they're too young to understand these complicated concepts," but when you break it down, they get it.
That's so powerful that you still remember a book that you read as a child. I completely agree. So many readers and families have come to us saying, "My kid is 3. My kid picked up this book and during their next doctor's appointment brought the book with them and pointed out what we were discussing in the doctor's visits." So not only are we teaching them and providing them with the tools to understand what's going on, but we're also encouraging them to get involved in their healthcare and have a stake in their lives and their bodies.
I know, I totally agree with you. I love that we're empowering children at a young age. What are some other ways to help kids take ownership of their health?
I really believe that educating them will motivate kids to want to participate in their health. I think that a lot of adults get caught up in the everyday lives, and it's very easy to just tell your kid to eat healthy, put a bowl of fruit in front of them and tell them to eat it. But I think we should involve them in the decision making. When they're younger, when they're 1 years old, it could be as simple as putting two healthy things in front of them and letting them pick one, like a banana versus strawberry for breakfast. But I think as they get older, I think we can involve them in more complex decisions and teach them how to make healthy decisions. And I think that involvement will help them not only succeed in making more difficult decisions later on in life, but it'll also motivate them to think critically about what they're putting inside their bodies, how they're taking care of their health, and how they're staying well.
Right. And we need this more than ever in our society today, right? Where it's so easy just to get on autopilot. We're busy. We're not making good choices with our health, with our sleep, with the things we consume and eat. I mean, really, honestly, it's a reminder even for adults, right? Because we have a hard time picking that healthy snack too. So it's really for all ages. But again, you're not too young. I guess I never thought about giving my kids a medical book at such a young age, but also there really wasn't anything out there. But I think if you are a friend of mine and you're having a baby, guess what you're getting in your baby shower basket. But yeah, we feel like, oh, they can't understand this, but really, this is the time to start instilling that. What about kids who have skin conditions, right? I mean, not every kid has perfect skin. Kids may have a large congenital mole, or maybe they have vitiligo or acne. So, what is your recommendation? for helping these kids feel confident?
Yeah. I think it's important to teach them that they're not alone, that you are there to help them, and that there is a physician in their lives, hopefully, or you can bring them to one that can help them with their condition. So, for acne and eczema, we have treatments for that. If a kid gets a breakout, we have someone that we can take them to, and we have treatments topically and orally that we can use. So, I think teaching the kids that it's okay to ask for help and it's okay to discuss what is concerning them or making them worried, and then providing them with the resources to address it. So if I had a kid with acne who brought up their concerns to me, or even if they didn't, I would want to have an open conversation about how much does the acne bother you? Does it hurt? Where are you getting it? And then taking them to someone who can help them. There are treatments, there are people out there, such as us, who are willing and able to help, and these kids should not suffer alone. But then also, I think realizing that these conditions are very common and that other people have the conditions as well so that they don't feel so isolated.
Oh, yeah. I mean, I had acne when I was a child, and I just felt like I was the most hideous person in the world. I didn't want to stand up or answer questions. I didn't want people to look at me. And, when I look back on it, I mean, I think, gosh, there are people who have it so much worse than I did, but it really affected my self-esteem. And of course, it felt like I was the only one in my friend group that was struggling with it. So I think just knowing this is normal, you are not alone. Other people have this, and there are things we can do. I ended up falling in the trap of doing a lot of DIY stuff, home masks, like stuff that wasn't really helpful and maybe even made it worse. So again, I think teaching kids where to go, where to turn for help. That it's not your fault you have this, right? It's nothing you're doing, and here's how we can help.
Absolutely. And I think it's important that these kids do seek help because some conditions don't go away over time. Acne can linger on into the 20s and 30s if it's not treated. And I think it's important to get the help early on and to show kids that it's okay to seek help for medical reasons.
I was talking with a dermatologist, a pediatric dermatologist, and she was saying that severe atopic dermatitis, or what people call eczema, that it was such a burden on not just the patients, but their families, that it was up there with having a child with cystic fibrosis when kids have very severe ones. So I think sometimes we underestimate how these skin conditions impact children, their families, the parents, the caregivers. And a lot of stuff in dermatology is not curable, right? It's things we can manage and we treat, but a lot of it isn't curable. So, especially with these kids, just helping them understand what's going on with their bodies, I think is important. So, I would love it. Are you planning to come out with more books talking about skin, or showing kids with different skin conditions that they might be able to relate to?
Yes, that's the hope. So right now we're planning to cover all the medical specialties. And once we have more of them covered, our goal is to go into the subspecialties and do every field justice. Like I think our dermatology for kids book excludes a lot of conditions that younger kids may have. And I hope to revisit it one day and be able to revise it or come out with a version two that goes more into detail.
Yeah, I mean, gosh, I just feel like there's so much to cover, and yeah, it's hard to pick and just pull it together because you can't make this, a big textbook. But Dr. Nguyen, you alluded to this briefly, but what are your plans for MD for Kids in the future?
Our goal is to grow our company to become a medical education company for kids that encapsulates all different types of media. So, right now we have a lot of books. We realize that not every family may have access to books or may be able to read the books to their kids. And so we expanded to a YouTube series. We created a 2D animation of cardiology for kids, and that's available for free on YouTube to families worldwide. And we also have a card game coming soon, a little card game.
Oh, cute.
Thank you. It's called Mindful Connections for Kids. And those are just different prompts that kids can use to have conversations with their parents or with their friends about how they're feeling and their goals for the future.
I love that. And you know what? I was just thinking, I saw a young girl today. I treat a lot of skin cancer, so I don't see a ton of children. But I had a little girl here today who's a dermatologist had been monitoring this mole on the bottom of her foot. And it was a little irregular, and we all kind of decided we should just remove it, know what it is for sure. But really, no, when I see her again, I'm going to tell her parents about the book because she can pick this book up. She can read about moles and what to look for, and she can compare and contrast it to the moles she had on her foot. So yeah, I just think it's making these complex subjects and our health accessible. So I really love what you're doing, Dr. Wynn. So exciting.
Thank you so much, Dr. Mina. That's so sweet of you to share a book.
I know people are going to want to find your book. They're going to want to follow your YouTube channel and see what you all are up to. Where's the best place for them to do all that?
Yeah, so our website is www.mdforkids.org, and our books are sold primarily through Amazon at amazon.com/mdforkids.
I love it. So many cute books, and of course I love the skin one. I'm partial to that one, but so much fun. I loved reading it. Great option if you have kids or you know kids, you know someone with kids. It's a great gift for them just to learn about their bodies because knowledge is power, right? And just having that understanding. Dr. Wynn, thank you so much for being here. I can't wait to see all the cool stuff you guys are doing in the future.
Thank you so much for having me. It's been such a fun conversation, and I hope that if parents have any questions, they feel welcome to reach out to us or to you. Our email is also below, but it's info@mdforkids.org.
Amazing. I will include all of that in the show notes so people can easily find it. And I will see everyone next week.